HSG. All right. This is an important procedure that your fertility specialist or your doctor may request you conduct when you are having difficulty in getting pregnant or when you are having recurrent miscarriage. And in this video, I will answer over 22 questions regarding HSG. Over 22 questions regarding HSG. So please listen attentively. All right. So the number one question is, what is HSG? HSG stands for hysterosalpingogram. All right. Hystero is a Greek word that represents the uterus, which is the womb, which is here. This is the uterus. And salpinx is a Greek word that represents the fallopian tube. And this is the fallopian tube. Remember, we have two fallopian tubes, the right and the left fallopian tube. Every female have two fallopian tubes. All right, naturally. Then, what is gram? Gram means to study. So, hysterosalpingogram, it means is a study of the uterus and the fallopian tube. You are studying the uterus and the fallopian tube. All right? So, that is what it stands for. Then, why will your doctor actually request for this particular test? All right? That's the number two questions. Your doctor may request for this particular test if a woman is having difficulty in getting pregnant. That is subfertility, or some people call it infertility. All right? They may request for this particular test to know whether the tubes are open and the uterus, which is the womb, is also in a good state. All right? Then also, your doctor may also request for this particular test if you're having recurrent miscarriage, early pregnancy loss. All right? That is because if there's abnormality within the womb, but that does not affect the fallopian tube, pregnancy may take place, but the pregnancy, you can be losing the pregnancy very early in the course of the pregnancy. All right? And this abnormality in the uterus can be acquired, that is, it occurred later in life, or it came from right from birth, which is called congenital. All right? When is the right time to actually conduct this particular procedure? Okay? Which is the HSG. The best time to conduct this HSG is about on the day 7 to day 10 of your menstrual cycle. All right? Day 7 to day 10 of the menstrual cycle in most cases. All right? That is because most women, the average menstrual cycle is about 28 days. All right? And for such, they will menstruate usually for the first 4 days or 4 to 5 days. Menstruation will last for about 4 to 5 days. And that means HSG, the best time to perform it is few days after the menstrual flow have stopped. All right? So the day 1 to day 5, most women, is the day of their menstruation. All right? The first day of your menstruation is called day 1. You start counting from that day. All right? So after the 5th day, you can give 2 more days, which is day 7, or 2 to 5 days, which is between day 7 and day 10, to go and conduct your HSG procedure. And why is it that these are the best day? One is that immediately after menstrual flow, the inside of the uterus, we call it endometrium, is thickened. Before menstrual flow is thickened. And immediately after, during menstrual flow, the extra thickness is sheared off. So this area sheads off. Okay? So what will be remaining will be something like this. Okay? So this area that is sheared off, together with blood, is what comes out as menstruum, all right? Which is what comes out during menstrual flow, all right? So after menstruation, the inside, the endometrium become thin. And just imagine, it is easier to actually check the shape of the uterus, the inside of the uterus, all right? When the endometrium is thin, to know the actual shape, it is better when the endometrium is thin. And the endometrium is thin immediately after menstrual flow has stopped, all right? Because after that, it gradually starts to grow. Just imagine you want to know the true shape of my head. You will appreciate the true shape of my head better when I have just little or no amount of hair on my head, all right? But by the time I carry an afro, you won't be able to appreciate the true shape of my head. That is the same scenario that plays out here, all right? That is one reason, okay? So the number two reason why it is done during this period is because remember that most women out there, they have a menstrual cycle length of average 28 days, and the ovulation takes place on day 14. This ovulation takes place on the day 14th of the menstrual cycle for those that have a menstrual cycle length of 28 days, all right? Okay, so ovulation must occur before fertilization can take place, before pregnancy can occur, all right? So on the day 7 to day 10, it means that there is no possibility of pregnancy at this stage for women who have menstrual cycle length of 28 days and above, all right? There's no possibility of pregnancy occurring because you don't want to conduct this procedure, HLG, when there is an ongoing pregnancy that maybe you, as the patient or the doctor, is not yet aware of. Because at this early stage, let's say if you conduct it on the day 18th and fertilization already took place, maybe you ovulated on the day 14th, and that same day or the following day, fertilization took place. And now you are now conducting this test on the 18th. It means that the zygote that is already formed that is trying to move down here, you may flush this zygote back, one. And two, you may expose this zygote or this zygote to X-ray unnecessarily, which is not good for in early pregnancy. And then you can, if this procedure can also make this pregnancy to get bad by exposing to contrast or even flushing it out. These are the second reason why it is done early. However, if you have a short menstrual cycle length, like the 21-day cycle length, you are likely to ovulate on the day 7. And if you conducting this HLG on the day 7, may actually also cause this problem. So for those set of people, all right, that have shorter menstrual cycle length, like 21 days, 22 days cycle length, it is advisable to also do this HLG procedure immediately after few days after your menstruation, which is 7 to 10 days. Well, however, you just ensure that you do not have any sexual intercourse during that, from the beginning of the menstrual flow to after you finish this HLG procedure, so that to limit the chances of you getting pregnant. That means in that particular cycle, you are going to forego pregnancy, all right, because of your short cycle length, and you need to conduct HLG.